Hello, welcome to your video for Chapter 18. This will be your video over the diseases of the musculoskeletal system and the connective tissue. A lot of the terms you're going to be hearing for this will be your bones, of course, your connective tissue, degenerative joint pain, ankylosing, arthritis, bursitis, cartilage. You are going to have so many different terms coming at you. So please make sure you take a few minutes to review those key terms. Any of them that stick out that you may not know what they are, make sure you're looking those up before you start this chapter. It is always a good idea to review your key terms, especially as you're going through them chapter by chapter. Make those notes in your code book. If you've got a couple terms in here that you don't recognize or that just aren't sticking in your brain from your med-term class, write those down in your code book as you're getting to that chapter. It is chapter 19, I believe, chapter 13 in your actual ICD-10 code book. So make sure that you're writing these terms down somewhere as you're going throughout these codes. If there's just a term that sticks out you don't know, write a note in your code book for those so that you have those whenever you take your certification exam. All right, you've got a couple of really good diagrams here. You've got the very first one, of course, just goes over your bones, a great one to review as well. Then your next one has got the muscles on the front to the anterior part of your body. And then the next diagram is the muscles for the posterior, the back part of the body. You're going to be coding from chapter 13. There are lots of different codes. They cover, I believe the code range is from M00 through M99. That should have been easy. I should have known that one. Some little tips and tricks that I want to kind of remind you guys of as you're going through here. You absolutely are going to need to know left, right for these. So it's going to be very important. You're going to have very specific, close to 6 and 7 digit codes for almost every single thing you're going to have to code for this one. Very, very few 3 to 4 digit codes are going to come out of this chapter. So make sure you're paying attention to that. Don't ever just go with your 3 or 4 digit code. Always flip to the back to check for those extra digits. In fact, if you guys will take a look at, let's go ahead and take a look at code M84, diseases of continuity of the bone. So pause the video if you need to, flip to code M84 in your code book, in your ICD-10 code book. Take a look at M84. It says diseases of disorder of continuity of bone, M84. Well, just M84 alone needs a 4th digit. So the next option we have is M84.3, a stress fracture. Well, that also needs a 5th digit. So now I have to keep going down until I get to M84.3 what? M84.31 needs a 6th digit. Well, where am I going to get the 6th digit? If I go down to M84.311, let's say I have a stress fracture of the right shoulder, M84.311. I now need a 7th digit. I'm out of digits here. I've got to have one last digit. There's not one below M84.311. So if you will notice the pink box above the M84.30, there's a pink box and it says A is initial encounter for fracture, D is subsequent encounter, G subsequent encounter for fracture with delayed healing, K subsequent encounter for fracture with non-union, P subsequent encounter for fracture with malunion, and S is sequela. So depending on what you're actually trying to code, it will tell you non-union, malunion, delayed healing, routine healing, that kind of thing. You will have those specifics in your patient charts. But when you're coding these, that is how specific they're going to get. So if you're looking for a stress fracture of the right shoulder, it gives you to M84.311. Then your 7th digit is going to come out of that pink box. It's going to be a letter A, D, G, K, P, S. In this case, your 7th digit is going to come out of that pink box and it's going to be a letter. It's not always going to be a letter. Occasionally it will be another number. So I just wanted you guys to be very familiar with that pink box. You will always use the pink box above the codes you're trying to use. So take a look at code M84.79. Find that in your code book. Pause the video if you need to until you find it. M84.79. This says pathological fracture, unspecified toes, M84.79, but I need a 7th digit to make this a complete because it has the little red check 7. I'm going to get my 7th digit for this code by going backwards to the pink box. Even if the pink box is the same below it, I have to go backwards to the pink box at right above M84.40. Because I'm in the M84.4s, I have to use the pink box associated with the M84.4s. So if I was going to use M84.79, I have to have a 7th digit out of that pink box that comes out of the pink box below the M84.4. Hopefully you are following along with me and I do not just sound like Charlie Brown's teacher talking a bunch of nonsense to you right now. It is very, very important that you guys grasp the concept of this pink box and how to utilize it to get your last digit. All right, we are going to jump into some coding. So we are going to start with coding assignment number 1. So coding assignment number 1 is cauliflower of the left ear. Pretty simple, pretty straightforward. We are going to look up cauliflower ear. I did have this one marked to make it a little bit easier and quicker for me to find. Cauliflower ear. And we have cauliflower ear, cauliflower ear. Where did you go? Cauliflower ear. There's only one code, M95.1. Notice it has the black check mark. We have to have additional digits here. So M95, let's go find that one. M95.1, and let's find out where we get our last couple of digits for this one. M95.1. M95.1, cauliflower ear. We have to know if it's unspecified, if it's our right ear or our left ear. Well, if you take a look at your textbook, it is cauliflower ear of the left ear. So our complete code for this one will be M95.12. So M95.12 is your code for this one. All right, for number 4, that's the next one we're going to do. Hypertrophy of the right humerus. What do we actually have? What would we actually look up here? We have hypertrophy. So let's find hypertrophy in our index. Hypertrophy of the right humerus. So if you just try to go hypertrophy humerus, you're not going to find it. Go ahead and look, because I know you're going to try to prove me wrong. You will not find hypertrophy humerus. You have to go hypertrophy bone. Your humerus is a bone. So you have to go hypertrophy and then bone. Under bone, you find humerus, and it gives you M89.32 with a check mark. Yes, you have to flip back to M89.32 to find out what your last couple of digits need to be. So flip to M89.32. Hopefully you're beginning to see that you are going to absolutely positively have to flip to every single one of these. You cannot code any of these out of the index. They are very specific codes. M89.32 says 89.2, 89.32. Hypertrophy of the bone of the humerus, and ours happens to be the right humerus. So we have M89.321. So your entire code for number 4 is M89.321. All right, the next one we are going to do is number 6. This is a pathological fracture of the left humerus, subsequent encounter with non-union. No, it's not so long that you need to just give up and skip that one. I know what you're thinking, most of you. So let's do this one together. What do we actually have? We have a fracture of the left humerus. So we go to the term fracture in our index. Fracture. Fracture of what? Fracture of our humerus. So we go fracture, humerus, fracture, fracture, fracture. I can't even find, there it is, fracture. Notice if you get to the very first one, fracture, pathological are both bolded in bold. So our pathological fracture is just a fracture. So fracture, then we go down to humerus, and we get M84.42 with a black check mark. So we have to go back to M84.42. M84.42 says we need a 6th digit. That's going to come from right below it. So M84.4, do we have left or right? This one said we had our left humerus fractured. So M84.422, and we need a 7th digit on this one. So we're going to have to use that pink box. Now we have got a non-union, subsequent encounter for non-union. So M84.422 with the 7th digit being K. Subsequent encounter for fracture with non-union. So M84.422K is your entire answer for number 6. All right, we've got a couple of coding assignments or case studies that I want to go over with you guys. The very first one is number 1. And this one says that the patient, if you read down through there, get to the extremities part, extremities were examined and revealed joint inflammation due to arthritis. Patient was instructed to avoid wearing tight footwear. Patient was advised to schedule an appointment with Dr. Town, a podiatrist, for an evaluation. Follow up in 1 month. The only thing we can possibly code him with is arthritis. So we just go to the main term, arthritis, and then we get the code. That one's easy enough. I think you guys will figure that one out. Number 3. This one says the patient was sent to the hospital for treatment, skilled nursing facility note. So he lives in a skilled nursing facility. This one says clinical impression. Fracture due to postmenopausal osteoporosis. So what does the patient have? They have osteoporosis, postmenopausal osteoporosis with a pathological fracture. So we have to go to osteoporosis first and then postmenopausal. So let's flip to that. Osteoporosis in your index. OST. Osteoporosis, postmenopausal, with fracture. And where did it say our fracture was? So here's where you have to go back. Patient's right leg, pain in her thigh, mid-thigh area. On-site x-ray showed a fracture of the shaft of the femur. So if you're not reading through those details, you're going to miss where this is, but you have to know. So we go osteoporosis, postmenopausal, with fracture, postmenopausal with pathological fracture of, let's say, thigh or femur. We don't have femur, finger, pelvis, radius, tarsus, tibia, toe, ulna, vertebrae. It doesn't give us femur. So let's go to M80.00. That's just our with pathological fracture. So M80.00, because I'm not seeing femur in the index. So M80.00. 0.00, age related. Now I'm going to go down through here. I see M80.01 is of the shoulder. M80.02 is of the humerus. 03 is of the forearm. 05, oh, look what's there. Femur. So here's where I need to be. M80.05. We have the right femur. Is that correct? Fracture, shaft of the femur. Right leg, so pain is in her right leg, so she has a fracture of the right femur. So we have M80.51. Now we need a 7th digit, so we have to go backwards to get to our pink box. This was the first time she's being seen for this, so we use the 7th digit of A. Initial encounter for the fracture, M80.051A is your code for case study number 3. All right, the last one I'm just going to let you guys know. For this one, there's not a significant diagnosis. It just says 46-year-old male patient, male carpenter, presents to the office today complaining of pain in his right leg area, which has increased throughout the day. Exam showed no limitations in ROM, which is range of motion, or reflexes. His skin is intact, neurological is normal. I instructed him to put heat to the area. So there's nothing wrong. He's just got pain in his leg for some unexplained reason. So we have to go to pain, leg. It tells us to see pain, limb, lower, and then it gives you your code. So you're going to reference the term pain, and then limb, and then lower, and it's going to give you the code. All right, your password for this chapter is going to be humerus, Humerus. So your password for chapter 18 is humerus. All right, that's it. I finished in time and I got the password in. Go me. You guys have a great week.